Hi, good evening, and welcome to Psychiatry Redefined, a webinar series. And I'll be introducing Amy Doyle, and we'll be talking about lavender oil in a little bit. But I get to share about 5 minutes introduction of what Psychiatry Redefined is. So I wanted to kind of do that first. And Psychiatry Redefined's been kind of educating clinicians across lots of disciplines for over 5 years now. And we have fellowships and these free webinars, as well as hundreds of hours of courses. So we have courses, we have books, we have a fellowship, we have a 3-month ADHD intensive, and again, hundreds of hours of courses that people can utilize. I think early on in my career, over 35 years now, I found a distinction between integrative medicine and functional medicine. Both are critical parts to the work that I do. 35 years ago, I felt like I was the only one using these words and terms in psychiatry anyways. And integrative medicine kind of took off, and we have now academic departments teaching mindfulness, Harvard, Stanford, their integrative medicine programs. But I think what has been lacking is a real functional medicine approach to mental illness, looking at lab tests, genetics, understanding the neurobiology, and the tremendous growth of functional medicine, functional nutrition has supported a lot of health and chronic health issues. But I still believe that psychiatry, mental illness, neglected. And Psychiatry Redefined really hopes to bridge that gap and teaches a functional medicine model, understanding the integrative medicine approaches. And so much of psychiatry now is just kind of polypharmacy. We're all familiar with it. It's just kind of educated guessing. And it's pretty scary. As I do consult on patients who've had 2, 3, 4, 6 medications prescribed, oftentimes they're still taking 2 or 3 because doctors are afraid to stop a medicine, even when they know it's not working. So our mindless prescribing has not been effective, and we're all familiar with outcomes that are barely 50%. Which is close to placebo for our psychotropic medications. So there is got to be a better job, better way, and functional psychiatry, Psychiatry Redefined looks at objective tests. That's a core of what we teach rather than just guessing. Science rather than beliefs, familiar in the news now. And with a functional medicine model, we can really look at and describe terms like remission and recovery. So much of mental health treatment, particularly our psychiatric colleagues, it's really symptomatic based suppression of symptoms. If you're sad, you get an anxiolytic, you get a benzo. If you're depressed, you get an antidepressant. There's no concept of, is it autoimmune disorder? Is it a hormonal disorder? Is it a GI disorder? Is it a mold disorder? Is it trauma? The list goes on. But a functional model and the core of what we teach is looking at remission and recovery based on looking at the underlying cause. And symptom suppression just works for some, but not for most. So again, we use a functional and integrative approach. And we have now over 100 hours of courses, and we have a 2-year fellowship. That is all on the webpage if you're interested. And these are the core courses that are part of the fellowship, which are all the major psychiatric illnesses, and then additional courses by Jacob Teitelbaum, Dr. Shaw, and other guest lecturers. So there's a lot of information. And every year we put on 4 conferences. These are all available. This was an incredible conference on nutritional low-dose lithium for cancer prevention, dementia, suicide. We did a conference on binge eating and food addiction. We did a conference on genetic testing in psychiatry, And then our last conference for this year is Child Psychiatry Redefined, looking at all the major psychiatric illness. So I will end with Alice in Wonderland. Sometimes I believed as many as 6 impossible things before breakfast. And this quote was kind of put into a book by Lewis Wolpert. And what he described, this was a number of years ago, but it's certainly frighteningly predictive of what's happening with COVID and the vaccines. But he talked about this power of belief, and particularly in alternative medicine. And this is a quote from his book: "Our belief engine, programmed in our brains by our genes, operates on different principles. It prefers quick decisions, it's bad with numbers, it loves representativeness, and sees patterns when there is only randomness. It's influenced by authority, and it has a liking for mysticism." And what he describes is the world of alternative medicine over the years, where people just believe what they hear or what they read, or the loudest speaker or the prettiest graphic, without the science. And it's just that belief engine. And it's my mission and the core mission of Psychiatry Defined, to really incorporate the science and to put our belief engine, which is so powerful, kind of on hold. Because as we look at our patients struggling with mental health problems, some severe mental health challenges, our current models are lacking. And to me, the alternative models of just throwing pills are also lacking. So we are on a mission to make a dent. So that's my presentation. And then I am fortunate to share an introduction for our speaker tonight. And this is going to be Amy Doyle. And this is a sponsored webinar from Integrative Therapeutics. And Amy is a board-certified nutrition specialist and owner of Whitestone Wellness, a private practice in Fayetteville, New York. She received a master's in applied clinical nutrition from the New York Chiropractic College in 2014. In addition to her practice, Amy works in various capacities as an educator, content writer for nutrition and integrative medicine communities. Amy's practice is empowering individuals towards best health by addressing them as whole person with a patient-centered, personalized approach. Critically important to our mission here. So I'm going to pass the mic and the screen over to Amy, and welcome and thank you.
Thank you, Dr. Greenblatt. I'm very happy to be here with you tonight and to share this information. Okay, so again, tonight we are talking about the evidence for and application of encapsulated oral lavender oil for anxiolytic and antidepressant effects. So tonight's objectives, I'm going to begin with a basic overview of stress, and then I will be talking about Selexin, which is a standardized lavender essential oil in oral form. And then I will be covering multiple clinical studies that address all of the points that you see here on the slide. So first, let's talk about the issue of stress and some of the downstream effects that we see with chronic stress. According to a 2000 study by the American Psychological Association, in the study of stress in America, 60% of Americans report dealing with chronic stress, and 34% of people experience occasional anxiety and fatigue. Now, we know that with stress anxiety comes its own set of comorbidities, and nearly 90% of people with anxiety also experience depression. And then 50% of those people also report occasional sleeplessness. So I am going to ask you to interact with me a little bit tonight. So I want you to think about these age groups from ages 18 through 74. And if you had to guess, which generation would you say reported the highest amount of stress in 2020? We have some that are saying boomers, millennial, okay, Gen Z, Gen X. So actually, the group that reported the most stress, if you said Gen Z, ages 18 to 23, you were correct. So according to the American Psychological Association's 2020 report on stress in America, Gen Z has reported the most stress. So comparatively, across all generations surveyed on a scale of 1 to 10, where 1 means little to no stress and 10 means a great deal of stress, Gen Z's average reported stress level was 6.1 compared to 5 as far as the average for all of adults. And Gen Z's stress level has been increasing since 2018. So our young people are under a tremendous amount of stress. So if we were to look at the difference between acute stress and chronic stress, with acute stress, we're looking at something that is short term, and the body's response, we've coined the term fight or flight. The most current representation of this is fight, flight, or freeze. And the body's response is quick and it's adaptive. So the example that I like to share with patients in terms of acute stress is I give them the example of you're walking down the street, you hear a noise behind you, and you look behind you and you see that a bear is chasing you. So in that event, what happens? Well, your body goes into an adaptation to that stress. And what it does is it equips your body to fight or flee that stressor. So you'll experience an increased heart rate, your pupils will dilate, glucose is released into the bloodstream in order to give your brain some fuel and your muscles some fuel. You'll have a release of epinephrine, which is also known as adrenaline. And then we'll also be releasing cortisol, which from the adrenal glands, which can help quell inflammation that can be part of that stress response. The key with acute stress is that once the stressor has passed, so the village bear catcher comes and takes that bear away, or you get someplace that is safe, those symptoms will resolve and your body will go back into homeostasis. So the important thing to know with acute stress is there's actually an end point. When we're talking about chronic stress is ongoing, persistent stress. And this is when the body is in a constant fight or flight phase. And this is when the brain and the body don't recognize that there's an endpoint because we have a repeated exposure to a stressor, we have prolonged cortisol elevation, and then we have what's called a loss of sensitivity to that stress. So then at that point, the downstream effects of chronic stress are a dysregulated stress response. And this ongoing persistent stress and a dysregulated stress response can have a diverse negative impact on the body's systems. So when we're looking at the functional medicine model and the functional nutrition model, we know that we practice root cause nutrition, root cause medicine, and that there is a biochemical individuality and uniqueness to each individual. So when we're talking about stress, we also recognize that the impact of stress is unique to each person. The issues resulting from chronic stress can persist for years and can affect most major body systems, including the GI system, our endocrine system, our hormones can be affected, our neurological system, our respiratory immune system. You can see here also our cardiovascular system is affected. So stress can also affect our physical, behavioral, and neuropsychiatric function. And that is why 30% of individuals with daily stress have taken prescription medication to manage their stress, their nervousness, emotional problems, or lack of sleep. So while we have the SSRIs, the SNRIs, the serotonin 5-HT2 agonists, these common antidepressants that target serotonin and its receptors or norepinephrine. We also have our benzodiazepines. These are our conventional treatments. However, they are not without their limitations. We know that some of the side effects can be delay to effectiveness. In some individuals, it can take 4 to 6 weeks for there to be effectiveness, and sometimes we're dealing with only partial effectiveness. We can also have withdrawal symptoms upon discontinuation. These individuals taking these conventional treatments can also experience drowsiness, sleep disturbances, restlessness, and these, especially the benzodiazepines, can be potentially habit-forming. There are different tools we can use to measure anxiety, and the tool used generally depends on who is doing the measuring. The Hamilton Anxiety Rating Scale, or the HAMA, measures the psychic and somatic anxiety, mental agitation and psychological distress, and physical complaints that are related to anxiety. It measures these on a scale from symptoms that are not present to mild, moderate, severe, and very severe. This is primarily used as an outcome measure in clinical trials. You'll be hearing a lot about the HAMA scale tonight. Generalized anxiety disorder is partly defined by excessive anxiety and worry for at least 6 months, and symptoms that are difficult to control. They have to be accompanied by at least 3 of 6 anxiety symptoms, and these symptoms have to cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The GAD-7 measures the severity of these symptoms by occurrence of the symptoms over a 2-week time frame. So it can range from no symptoms to several days of symptoms, more than half of the days, nearly every day. And this is used primarily in a doctor-patient setting to diagnose the severity of GAD. So these are clinical and diagnostic tools. However, an individual or patient might describe anxiety or stress very differently than what we see on these scales. So I would guarantee that if an individual were to come into a mental health practitioner's office or a physician's office and describe their anxiety, they're not going to say, well, my score on the HAMA rating scale was. So let's think for a moment about if a patient or an individual were going to describe their individual experience, what are the wide range of symptoms that an individual might use to describe? You can put this in the chat box. One that I've heard from my patients is difficulty sleeping, heart palpitations, jitteriness. Can anybody contribute any others? Okay, disorganized thinking, racing thoughts, yes. Sweating and clammy, a constant feeling of dread. So we notice here that the symptoms are not just something that can be measured by severity. It's also, we have symptoms that are cognitive function, gastrointestinal function. We can have shortness of breath and hyperventilation. Exactly. So there's a wide range of symptoms. So it's not just the diagnostic scale, it's also a patient's individual experiences that are important. Okay, so we'll round out this section on stress with a pop quiz. What percentage of Americans report having chronic stress? Is it 10%, 40%, or 60%? Okay, so if you answered C, you were correct, it's 60%. So more than half of Americans report having ongoing persistent stress. In my personal opinion, that number is much higher. So which of the following are side effects commonly seen with conventional treatments for mood and stress? Is it A, delay to effectiveness, B, drowsiness, C, withdrawal concerns, or D, all of the above? I see everyone that's responding in the chat is responding D, all of the above. Yes, that's correct. These are all common side effects seen with conventional treatment. Okay, so moving on to Selexin. Selexin is also known and marketed under Lavella WS1265. Going forward, I'm just going to refer to it as Selexin. And again, Selexin is a standardized essential oil extract of English lavender and is designed for oral administration. Well, lavender is most well known for its application in aromatherapy. Generally, it's not advised to ingest lavender orally. However, Selexin is a novel preparation that has been designed for oral administration. So essential oils they're complex compositions of compounds that can contain up to several hundred distinct chemical entities. So very much like herbal products, they vary in constituents because the aromatic compounds are a product of the growing environment, the plant's genetics, the harvesting, the storage, and as well as the manufacturing process. So in this case, the oil extraction process. So the concentration of active constituents can vary from batch to batch of essential oils and product to product. So what you see on the label is not always what you get. However, with Selexin, Selexin complies with and exceeds the quality parameters of the lavender oil monograph from the European Pharmacopoeia. The main constituents are linalool and linalool acetate, which are approximately 70% of the constituents in Selexin. And it undergoes a highly standardized process of cultivation, harvesting, and distillation to ensure batch-to-batch consistency. And the dosage of Selexin begins at 80 milligram gel capsules. So lorazepam is a benzo, and it's often sold by its name lorazepam or under the brand name Ativan. And this was a 6-week study. So the efficacy of a 6-week intake of Selexin compared to lorazepam was investigated in adults that had a diagnosis of generalized anxiety disorder. After the treatment phase of 6 weeks, there was a discontinuation phase, and this was started by reducing the medication step by step for another 2 weeks. So you can see here that the individuals were randomized to receive 1 capsule of 80 milligrams of Selexin and a capsule of lorazepam placebo, or they were given 0.5 milligram of lorazepam and a placebo of Selexin. The primary outcome that was measured in this study was the HAM total score. So the results of this study are represented in the graph on the left. You can see on the graph that we have the HAM total score reflected vertically on the left, and the time is reflected horizontally on the bottom. So if we look at what this graphical representation means, the mean HAM score was decreased in the Selexin group by 45%, and the mean decrease in HAM score in the lorazepam was at 46%. So what this means is that Selexin is as effective as the benzodiazepine lorazepam for reducing occasional anxiety without the sedative effects and without withdrawal effects. It appears to be an effective and well-tolerated alternative to benzos for generalized anxiety. And looking at paroxetine, so paroxetine is an SSRI antidepressant, and it can be sold under the brand name Paxil, Paxiva, or Brisdel. It's also a first-line treatment for GAD. And this was a 10-week double-blind treatment. After the 10-week active treatment phase, a 1-week discontinuation phase was implemented because the paroxetine needed to be down titrated. What's awesome about this study is it's the number of participants. So you can see that there's over 500 participants, both male and female, between the ages of 18 and 65. And it's very rare that we would see a natural product being studied on this scale. Rather, we would typically see 30 to 40 participants. So this is a very big, bold, robust study. And it actually has multiple arms. It has an arm of an 80 milligram intervention, 160 milligrams intervention of Selexin, and placebo, along with an intervention of paroxetine. So in regards to the 1-week discontinuation phase at follow-up, there were no withdrawal effects seen with discontinuation of Selexin at either dose. And Selexin at both 80 milligrams and 160 milligrams was superior to placebo. What this shows us is that Selexin is efficacious at both doses, 80 milligrams as well as 160 milligrams. It's well tolerated, and it does not cause symptoms of withdrawal like paroxetine. So in stepping back and looking at these two studies, we can see that Selexin has been clinically studied in over 500 individuals. It's comparable to conventional treatments for occasional anxiety. Improvement with Selexin is seen in as little as 2 weeks. And with the 160 milligram dose, there's statistically significant effects at 4 weeks. And looking at the 80 milligram dose, there's statistically significant effects at 6 weeks. Selexin is generally well tolerated, it's non-drowsy, and there are no withdrawal effects. So it's one thing to have some data to work with when it comes to the clinical trials, the human clinical trials, but what I also get excited about are the effectiveness that's seen in actual clinical practice. So what are mental health professionals saying about Selexin? This publication, it's called, the article is entitled Selexin, a novel anxiolytic. And this, if you're not familiar, Carlet Publishing provides clinicians with practical, engaging, and unbiased psychiatric education. So their goal is to provide information that's actionable so that clinicians can immediately apply what they're learning to enhance their day-to-day practice. And this was written by the editor-in-chief and practicing psychiatrist, Dr. Chris Aiken. And he notes that in his own personal experience since 2016, he has treated over 500 patients with Selexin, most of them having generalized anxiety disorder or another mood disorder with anxious distress. He states that his experience has been in line with the research with the best results in pure generalized anxiety disorder. So he notes the efficacy here, but he also notes that there's a lack of withdrawal symptoms. The patients often forget to reorder Selexin. The change of their symptoms returning after a few months is so gradual that most patients don't even notice it. So we all have those patients who maybe fall into one of these categories. One, maybe they've had a bad experience with polypharmacy. They might have had bad or negative reactions to the benzodiazepines or the side effects from SSRIs, and they would prefer not to take one of those medications. We also have those patients that they just prefer a natural approach. They are in any kind of medication they try to avoid, and they prefer a natural approach. Well, Dr. Aiken states that Selexin is a reasonable choice for patients who have not responded to FDA-approved treatments for GAD, and those patients who prefer natural approaches could use it first line. So the verdict from the Carlat Psychiatry Report is that most complementary and alternative medicine therapies do not have robust effects, but Selexin is an exception. You can consider it in adults with generalized anxiety disorder. This is a collective opinion. This consensus statement is a collective opinion of 20 plus mental health professionals, and it also includes the latest scientific findings regarding anxiety disorders. In this consensus, the authors document the fundamentals of diagnostic and therapeutic practices, and it's intended to be used as a point of reference for everyday clinical practice. They discuss in this consensus drug-based treatment for anxiety disorders, psychotherapeutic treatment like cognitive behavioral therapy, and also phytopharmaceuticals. So in their section on phytopharmaceuticals, they endorse Selexin, and they discuss its superiority over placebo and its comparable efficacy versus lorazepam and paroxetine in those patients that have generalized anxiety disorders. So in this study, Yap and his colleagues looked to answer the question, what is the efficacy of Selexin in reducing anxiety, and is it safe? So here they looked at 5 randomized controlled trials with Selexin versus placebo, as well as the lorazepam and paroxetine studies. So the effect of 80 milligrams was observed to be the same as that of paroxetine. However, when they pulled all of this data together, there were no improvements that were observed for the group receiving lorazepam against all comparators. However, they did note that there was fatigue and as a side effect in those individuals that were in the lorazepam groups versus no fatigue in the Selexin group. What they also discovered was that the 160 milligrams per day of Selexin appears to have the greatest effect on reducing HAM scores. So the researchers embarked on this review to study the pharmacology, the efficacy, and the safety profile of lavender oil. And what we can say here is that Selexin demonstrates it produces a calming effect without sedation. It's non-habit forming, and it does not cause withdrawal symptoms when discontinued. So what about the physical symptoms that can often accompany anxiety, like insomnia, pain? There can be heart palpitations. Some patients can complain of genital urinary symptoms. And the researchers here wanted to assess Selexin's therapeutic effect on these types of symptoms. So this was a meta-analysis that looked at 5 studies and examined the therapeutic effect of Selexin on these particular somatic symptoms. And what they found is that there was clear superiority of 80 milligrams of Selexin versus placebo in improving these types of symptoms over a 10-week treatment period. I had mentioned earlier that nearly 90% of people with anxiety also experience depression. And the authors here asked the question, well, how does Selexin have an impact on depression? And does it have an impact? So this article reviewed 7 clinical trials in patients that had generalized anxiety disorder, and they used the HAMA total score reduction as a clinical outcome, along with the assessment of single factors that are related to depression, and including quality of sleep. So they looked at the HAMA total score, they looked at single factors that had to do with depression symptoms, and they looked at the individual's quality of sleep. What they found is that these 7 clinical trials have shown us that Selexin is effective for occasional anxiety, as well as beneficial for coexisting depression. It can improve anxiety-induced poor sleep, and it's also safe. It has an excellent safety profile and well tolerated without withdrawal symptoms or any known drug interactions. Okay, so another pop quiz for you. Which treatment provided the greatest reduction in HAMA score over the course of treatment? Was it 80 milligrams of Selexin, 160 milligrams, 20 milligrams of paroxetine, or D, 3 bars of chocolate? Okay, I see a lot of answers B, or 160. Yes, the dosage that had the greatest effect in terms of reducing the HAMA score was 160 milligrams. True or false? Selexin has been observed to be effective in as little as 2 weeks. Yes, it has been observed to be effective in as little as 2 weeks. That's true. Okay, so let's talk about the mechanism of action with Selexin. Well, despite some similarities in the anxiolytic action of benzodiazepines and SSRIs, Selexin does not interact with the typical targets of these standard anxiolytics. So here I'm just going to do an overview of our nerve cells. And here in this picture, we have 2 neurons or nerve cells, and the transfer of information between these 2 neurons takes place at the synapse. On the left, we have the presynaptic neuron or presynaptic terminal. And on the right, we have the postsynaptic terminal or the postsynaptic neuron. So the presynaptic neuron transmits a signal toward the synapse, where a postsynaptic neuron or terminal transmits the signal away from the synapse. So if you just hit the snooze button there, I'm going to rephrase that in a way that I explain it to my patients. Think of this as a pitcher and a catcher. So on the left, we have the pitcher, which is the presynaptic terminal. And the pitcher is throwing to the catcher, which is the postsynaptic terminal. And the plate or the field that is the ball is being thrown across is the synapse. And the actual ball that's being thrown is the neurotransmitter. Now, why is this important in our talk about Selexin? If we look here, what you can see is these 2 bars represent voltage-dependent calcium channels. So voltage-dependent calcium channels is how calcium ions actually enter the neuron. Calcium is vital for neurotransmitter release. So you can see these blue circles here are calcium ions, and they're entering the presynaptic terminal. When calcium is increased into the presynaptic terminal, there's also an increase in neurotransmitter release. So studies have shown that if we can modulate these calcium channels, we can either aggravate or we can ameliorate anxiety-related behavior. And some of these calcium channels have been shown to regulate neurotransmitters in areas of the brain that are related to fear and anxiety. So this brings us to the mechanism of action with Selexin. So again, even though there are similarities in the anxiolytic action of Selexin and the conventional treatments that we see today, Selexin does not interact with the typical targets. It does not interact with GABA receptors. It doesn't have the sedation effect. So what Selexin primarily does is it inhibits different types of calcium channels. So on the left, we have what's called a hyperactive nerve cell. And here we have an excessive influx of calcium ions through the calcium channel, and then we have an excessive release of neurotransmitters. I like to say that in a hyperactive nerve cell, the volume is cranked up. Selexin has been shown to normalize hyperactive nerve cells. So if we look at the diagram on the right, we can see that it's modulating the calcium channels, and it's reducing the influx of calcium ions, and it's also reducing the release of neurotransmitters. So let's zero in on evidence as it relates to any addiction or withdrawal concerns with Selexin. The authors here wanted to know what happens if we abruptly discontinue Selexin. So this was a randomized double-blind clinical trial, and it assessed not just the efficacy of Selexin compared to placebo and paroxetine in patients with GAD, but it also looked at the possible withdrawal symptoms that occurred when Selexin was abruptly discontinued. So withdrawal symptoms were measured with a physician's withdrawal checklist. And what they discovered is at the end of week 10, there was a paroxetine was tapered and Selexin was discontinued abruptly. So what they discovered was that Selexin does not induce dependency. It can be safely discontinued without tapering, even after long-term use, unlike paroxetine and some of the benzos, which doses generally need to be tapered. So we discussed earlier that some of these conventional treatments have abuse potential. And so what the researchers here in this particular study were looking for is there abuse potential with Selexin? All the participants in this study reported using CNS depressants during the past year, as well as opioids, morphine derivatives, cannabinoids, and stimulants. They were given single oral doses of the 80 milligrams Selexin, as well as an 8-fold superdose of Selexin at 640 milligrams, along with 2 milligrams of lorazepam and 4 milligrams of lorazepam in randomized order. Compared against lorazepam, which has known abuse and addiction potential, after each administration, the participants completed an inventory of rating scales to describe their subjective effects of the drugs and their similarity to other drugs that they had personally used before. And what they determined was that the results did not reveal any signal for abuse potential of Selexin, either at the therapeutic dose of 80 milligrams or at the superdose of 640 milligrams. So always a concern with any kind of herbal product or essential oil or medication is there interaction with other drugs? So the first study is looking at the interaction potential of Selexin with major cytochrome P450 enzymes. So if you're not familiar, P450 enzymes are a group of enzymes that are involved in drug metabolism, and they're found in high levels in the liver. Certain things can cause these enzymes to be inhibited, or they can cause the activity of these enzymes to be increased. So if an enzyme's activity is increased, it can actually cause the drug to be cleared quicker from the body. If the enzyme's activity is inhibited, it actually increases the bioavailability of that drug, so more is absorbed and it can increase the blood levels of that drug. So an example of this is if you've ever seen a warning on a prescription label about avoiding grapefruit juice with that medication, that's because grapefruit juice can actually inhibit a cytochrome P450 enzyme, and therefore it can increase the blood levels of that medication. So the individuals were given Selexin along with a cocktail. Now this cocktail had caffeine, it had an anti-diabetic medication, there was a drug that's used to treat acid reflux, there was an ingredient in there that's an over-the-counter cough suppressant, and a benzodiazepine. And what they found is that there were no relevant interactions found with the co-administration of the 160 milligrams of Selexin and this drug cocktail. So the reason that they use these particular drugs in this cocktail is that they are all metabolized by different P450 enzymes. So they can plug up different lanes of traffic in the liver if these enzymes are either inhibited or activated and increased by Selexin. So this drug, this cocktail, these different types of drugs in this cocktail are representative and account for over 86% of all drugs and how they're metabolized. So this is really kind of an all-encompassing cocktail that represents 86% of all drugs and how they're metabolized by the liver. So again, there were no relevant interactions found with major cytochrome P450 enzymes and Selexin. Another study was performed to investigate possible effects of co-administration of Selexin and oral contraceptives to see how Selexin affects the pharmacokinetics of oral contraceptives, so how these oral contraceptives move through the body and how they function in the body. And what they discovered is that there was no reduced efficacy of the oral contraceptive, no changes in the bioavailability of the synthetic hormones in the oral contraceptive. There's also no influence on endogenous sex hormones, the endometrial thickness, or ovarian activity. Why is this important? Well, since anxiety and restlessness have a high prevalence in younger women, the co-administration of Selexin and oral contraceptives is very likely. So if you remember the big paroxetine study where they had a 160 milligram arm, an 80 milligram arm, and they had a placebo arm. Well, if we refer back to that, then we can say, well, what's better? Is it 80 milligrams or 160 milligrams when it comes to dosing? Well, if you remember, and what I pop quizzed you on is the 160 milligrams had the greatest effect. Well, this is when we also go back to the patient's individuality and their experience. So, for example, I personally have a patient who only experiences anxiety when it's time to go to sleep. And so her anxiety affects her ability to fall asleep. And what we found, and you'll see in a study later, is that for her, all other factors considered, when we provide 80 milligrams of Selexin in the evening, it tends to alleviate her anxiety in the evening, and she's able to fall asleep. Now, you also may find that, so that's her own individual patient experience. But you also may find that a patient has a preference. You may have a patient who is sensitive. They like to move low and slow when it comes to supplementation versus those who are more aggressive, those patients who are the I need something right now type of patient, and they want a robust response right away. So there is no concern with going low and slow, starting at 80 milligrams, depending on the patient's sensitivity and preference, or starting with a more robust dose at 160 milligrams and determining the response that the patient gets from either of those doses. So I touched on Selexin's effect on sleep for my individual patient, but does Selexin help with sleep if an individual is not experiencing anxiety? This looked at 221 patients that had subsyndromal anxiety disorders as well as impaired sleep. So what this analysis investigated was the degree to which Selexin had direct beneficial effects on disturbed sleep and the degree to which the effect on sleep had something to do with the reduction of anxiety symptoms. You can see here in this slide, this is a graphical representation of the different variables. On the left, bottom left, we have the independent variable, which is treatment with Selexin or placebo. So we're looking, does it directly affect sleep, which is our dependent variable on the right. And then our indirect effect on the top is a change in the HAMA score. So a change in the individual's rating of their personal anxiety. What we see here is that 98.4% of the effect on the individual's disturbed sleep had to do with a reduction in their anxiety, whereas only 1.6% of the effect came from a direct effect on sleep. So what does this mean? This means that treatment with Selexin actually led to a significant reduction of anxiety symptoms in these participants. The reduction of the anxiety symptoms led to a significant improvement of sleep. However, treatment with Selexin led to no significant direct effect on sleep. So what this means is that Selexin improves sleep with an important aspect. It exerts its sleep improving effect almost exclusively through its anxiolytic properties and not through sedation. So Selexin does not affect sleep directly by causing sedation, rather it reduces anxiety symptoms, which can improve an individual's sleep. Okay, there have been some questions that have been raised about lavender oil and whether or not it has estrogenic potential. So I wanted to answer the question, does Selexin have estrogenic potential? Currently, there is no clinical evidence, neither from Schwaba's, which is the manufacturer of Selexin, own numerous clinical trials, nor from post-marketing spontaneous reporting systems that Selexin may have adverse effects on the endocrine system or interfere with sex hormones if used as directed. The only publications available on potential endocrine effects of lavender oil are case reports on gynecomastia that are prepubertal. And the suspicion was raised that lavender oil may exert estrogenic activity. However, this refers to the topical use of lavender oil. So the topical use of cosmetic products which were labeled to contain lavender oil. But there was no qualitative and quantitative characterization that was provided that could look at other possible causes of the gynecomastia. But because of this concern, this is what drives the recommended use of Selexin in ages 12 plus. So what about lavender in regards to menopausal symptoms? Well, what we found is that lavender aromatherapy or massage actually supports menopausal symptoms. It can improve symptoms of flushing, mood, pain, and sleep. And therefore, there's currently no evidence that a potential exacerbation of menopausal symptoms with lavender oil is plausible. And there's nothing in the clinical or non-clinical literature that supports that there's any estrogenic potential of the oral use of lavender oil. So when we talked about the side effects that we can see with conventional treatments for anxiety, we know that we've seen that there's drowsiness in some individuals, there's delayed reaction time, and that's why on many of these medications you see a warning label that says, do not drive a vehicle or operate machinery until you know how this medication affects you. So the researchers in this next study sought to ask that same question: does Selexin actually affect driving performance? This was a two-part study. So at the beginning, the patients were given what you see in the part 1 section, and then part 2, they were given single doses of Selexin at 160 milligrams and a lorazepam placebo, 320 milligrams of Selexin and lorazepam placebo, and then also lorazepam and a Selexin placebo. There was a 7-day washout period between both of these parts of the study. And what the assessments included was an eyelid closure index, how often the patients nodded in terms of closing their eyes, a sleepiness scale, and then a simulated driving test, and also lane keeping and driving errors. So with driving errors, they were looking at the individual's reaction time, how close they got to other vehicles, etc. What they found is that there were no adverse effects of Selexin on overall driving performance that was observed by the investigators or in the subject's self-rating. There was all of the parameters that were measured, like eyelid closure index, reaction time, and alertness. Selexin did not adversely affect any of these measurements. And then in comparison to lorazepam, driving performance after placebo and Selexin was superior to that in the lorazepam phase. So there's been anecdotal as well as clinical evidence about the benefits of aromatherapy when it comes to lavender oil. So what is the evidence in terms of the efficacy of aromatherapy versus Selexin or oral lavender oil? This actually study looked at 32 different studies. They were not head-to-head comparisons. They actually did statistical modeling based on the evidence of and results in the different studies that used aromatherapy and different applications of lavender, as well as oral lavender like Selexin. So there was follow-up that occurred after the first week. Follow-up occurred after the first dose of each of these treatments, and then also at the end of each of the studies. And what they found is that there's significant difference in patient anxiety in the first week and the first time of follow-up, but that was only seen with the lavender aromatherapy. The lavender massage and foot bath was the most effective for short-term and after the first dose. However, as the duration of the studies progressed, lavender oil supplement had greater anxiolytic effect. It became more pronounced as the duration progressed. And so with longer duration, Selexin was preferred. And this actually matched what we see in clinical studies. So efficacy beginning in 2 weeks and then significance at 4 weeks and 6 weeks for 80 milligrams. So at the end point of all of the studies, the oral treatment with Selexin actually ranked first and its efficacy increased over time. So when it comes to the selection of, is aromatherapy more suitable for an individual or is Selexin more suitable, duration is key. So we're looking at, if we go back to that acute stress or short-term difficulty sleeping, short-term symptoms, then lavender aromatherapy in the form of massage or foot bath may be suitable for that individual. However, when we're looking at chronic stress or generalized anxiety disorder, like we've discussed tonight, then for the long-term, oral lavender has been shown to have a greater efficacy. So the recommendation with Selexin is to take 1 soft gel twice a day. And this can be, again, adjusted based on the individual patient. It can be 1 to 2 soft gels a day. Again, we see clinically relevant improvements in 2 weeks with statistical significance at 4 weeks. There's no known drug interactions with Selexin, and it's non-drowsy. There are no withdrawal effects, and it's generally well tolerated. And then, of course, we've shown that it doesn't interfere with oral contraceptive metabolism or the major cytochrome P450 pathways. So that concludes what I have for you this evening. Heather, did you want to share any questions with me?
Absolutely. We've got several here. So let's just dive right in. How does lavender compare to valerian in efficacy and tolerability and safety?
I'm not familiar with valerian. I believe, if anyone can correct me on this, a valerian does have a sedative effect. But in terms of efficacy, that I'm not sure of. I personally don't use valerian.
Can the encapsulated lavender oil be used during pregnancy safely?
There have been no studies for its use in pregnancy.
This person says they're most concerned about GI side effects with the Selexin. Can you discuss that and how to avoid them?
Well, if anyone has ever taken a fish oil supplement and a few minutes later, maybe a couple hours later or throughout the day, you get that fishy burp, that erudication, that is the same thing that you can experience with Selexin. The most common side effect is that lavender type burp. I've seen it often can subside within a week or so of regular use with an individual. There are some individuals that if there were any adverse effects that were reported in these clinical studies, it was just general upset. It's important that the individual drink a full glass of water with the Selexin dosage, but also sometimes if you're starting at the 160 milligram dose, you can actually go back down to the 80 milligram dose. To see if that improves for the patient before going back up to the 160 milligram.
What do you recommend for chronic generalized anxiety? Can this be used for chronic versus more occasional?
Absolutely, yes.
Do you prefer starting patients out on the 80 milligrams or the 160 milligrams? Is it a case-by-case situation that kind of determines the starting dose?
Yes, I personally do a case-by-case situation. I also have had individuals who are on an SSRI and they, in a period between doses, for example, they may start to get some of their symptoms come back before it's time to take their next dose of the SSRI. And I've used I've used Selexin as a bridge during that time. So a patient might take it once a day. So if she has to take something in the morning and then she takes her second dose of her antidepressant in the evening, right around dinner time is when she starts to feel her symptoms come back. So in that case, the patient just took the 80 milligram dose around that time of day and that helped her.
Okay. Have there been any studies in children?
There have not, no.
Okay. I think you addressed this somewhat. Regarding the mechanism of action, are we talking about norepinephrine modulation or another neurotransmitter?
That's a good question. That might be a good question too for Chris at Integrative Therapeutics.
Yeah, and there's some questions about, where it can be purchased, if it can be purchased in Canada and Australia. And I don't know, that might be a really good question for Chris as well. I think you mentioned it doesn't work on GABA necessarily, right?
Yes, the studies have not shown that the mechanism of action has an effect on GABA. It's not a target.
And serotonin though?
There was one small study that showed that it, and I don't want to misquote it, but there was one small study that did show that there was some type of serotonin effect. Whether it was the receptors, I'm not sure, but it really wasn't robust enough for Integrative to make that as a claim that that's what it does.
And for some of these questions that are very product specific and where can it be purchased, things like that, I just posted Chris Alley's email address a few moments ago in the chat. And there it is right there as well. Perfect. He would be a great person to ask the types of questions about. He's also who you would need to contact to get your special 10% offer.
Yes, and Chris can be the one that can let you know, answer those questions if it's available in Australia or Canada, all of that.
Absolutely. Okay. I think you mentioned that Selexin does not alter hormones. If you can maybe clarify that again. And the same person was asking if you can use this for panic attacks.
Yes, it does have, it's an anxiolytic, so it functions as an anxiolytic, so it can help. I've used it in those patients. If we think about that spike that happens in anxiety when an individual has panic attacks, we don't see clinical studies, but again, if we go by an individual patient's experience, the symptoms that are the panic attack are often symptoms that are seen with just a generalized anxiety disorder. They're just more pronounced and they're immediate, they're acute. So if an individual is experiencing a chronic situation of panic attacks, I found that it can be helpful for those patients in my own personal experience.
Is Selexin safe to use along with other antipsychotics?
With antipsychotics, well, according to the studies, there, as we said, that the cocktail that was used, it represented about 86% of the drug metabolism of all of the drugs in the marketplace. So there have not been any contraindications listed with antipsychotics. It can also be used along with benzodiazepines and antidepressants as well. But to my knowledge, there are no contraindications with a antipsychotic.
Okay. And someone was asking, they said that they had heard that Selexin could potentiate benzos.
Well, if we think about the effect of benzos, you might find that they have the same effect as each other. So if someone is on a benzodiazepine and it's working, then why would they be taking Selexin? I've used it personally in patients that are on a benzo or on an SSRI, and they would like to eventually not have to take that. I've worked in collaboration with their physician so that they can eventually no longer have to take those. But so my question back, I guess, would be, well, if they're on a benzodiazepine that's working, what would be their reason for taking Selexin? And you'd have to take that on a case-by-case basis and see. You're not going to get side effects that you get from benzodiazepines, like the sedative effect, things like that. They might be more relaxed. They might have a greater anxiolytic effect, but it's not going to increase in terms of side effects, things like that. Does that answer that question?
Yeah. And do you think it would be helpful if someone's tapering off something like a benzo?
Absolutely. I've used that. And again, I can't prescribe and I can't tell a patient to stop a medication. So it would be in collaboration with their physician, with the physician's full knowledge that they want to titrate down or eventually come off of that medication. And in those cases, I've used Selexin along with other nutritional components to help for Selexin to be the bridge as a patient comes off of these medications.
Are there any geriatric considerations?
The only side effect, adverse effect that I've seen with Selexin, and that is in the clinical studies, is that that nausea, some of that stomach upset. So that's the only information that I have, bariatric information.
Okay, and someone who just had to hop on late is asking about the mechanism of action again. Could you maybe reiterate that just a bit?
Yes. So when we look at the mechanism of action of Selexin, we know that it does not target the same areas that some of the benzodiazepines. So in other words, it doesn't target GABA. We don't see overwhelming evidence that it targets the serotonin receptors yet. What we do see, however, is that it actually can normalize a hyperactive nerve cell where we have an excessive influx of calcium into the calcium channels. It actually can modulate those calcium channels to reduce the influx of the calcium ions, and thereby it reduces the neurotransmitters that are going across the synapse. So I like to say it turns the volume down on a hyperactive nerve cell.
The long-term studies, how long were they?
The longest term study in the clinical studies that we talked about today were 10 weeks was the longest.
Someone was asking about the placebo in the first study with lorazepam. Could the 1 milligram placebo, could that have made the participants believe that they were getting lorazepam?
Well, we do have a placebo effect, so that's possible.
Are you aware of any insurance coverage for this?
Not to my knowledge.
You've got questions about Germany and Europe as well. And I'm sure that you can contact Chris and he'll be able to answer some of those more product and sales related questions. And that's also who you'll contact to get 10% off of your first order. Can Selexin be used PRN?
I have personally myself used it PRN. I've used it myself where I took it for an extended period of time and then I just used it PRN and I found that it was effective. I have not seen any of the studies that have shown that it can be used PRN though. So that's just my personal experience.
Someone has questions about the price as well. So again, these are great questions for Chris. Ali, who's been posting in the chat here, and I posted his email address there as well. Have you heard of any benefit with it for migraines specifically?
I have not.
Well, I think that does it. Amy, thank you so much. It was a very informative presentation. We very much appreciate information on an option like this.
You're very welcome. It was my pleasure.
Thanks again, everyone.
Thank you. Good night.